Hi, my name is Khanh. I'm the project coordinator for the San Francisco SBIRT Collaborative Education Project. I'm here to show you our recently developed SBIRT app. It is designed to help transfer the SBIRT skills from the classroom to clinic. And here is the home page of the SBIRT app. As you can see here, learners will mostly use the review and apply section. The review is sort of the fountain of knowledge where they are able to gain information from screening, brief intervention, and referral to treatment, as well as videos and case illustrations. The apply section is the toolkit where the learner will have access to all the screeners, as well as recommendations for brief intervention and some referral tips. So next, I'm going to show you a learner using the SBIRT app with a patient screening for alcohol use. Hi Jason, thank you for coming in again today to answer some other screener questions today.
Sure.
You did answer some outside, and I'm just going to do some follow-up and ask some other initial questions with you.
Okay.
Again, I do ask all these questions with my patients, so
Okay.
it's going to be the same ones I asked you today.
Okay.
So I'm going to pull out this phone app. We have all the questions here for me, and it's going to help me facilitate our conversation a little bit, okay?
Sure.
So I'm going to start a new screener.
Yeah.
And I'm going to ask you about, I'm going to screen you on alcohol and depression.
Okay.
And your demographics here. And your age is within 22 to 64.
Yeah.
And just want to let you know, all the responses that you give me today will not be stored anywhere. It's just to help me follow through with what are the questions in the screeners.
Okay.
So
right.
None of it will be
So it's just an FYI kind of thing to help us see if there's anything more to talk about.
Yes.
Okay.
So I'm going to go ahead and start off with screening with alcohol use.
All right.
Okay.
Yeah.
So how often do you have a drink containing alcohol? Never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, 4 or more times a week.
2 to 3 times a week.
Okay. How many drinks containing alcohol do you have on a typical day when you are drinking? 0 to 2, 3 or 4, 5 or 6, 7 to 9,
3 or 4.
3 or 4. How often do you have 5 or more? Has a relative, friend, doctor, or other healthcare worker been concerned about your drinking or suggested you cut down?
No, not that I know of.
All right, so here it gives me a score of 11. So it puts you, so you have had experienced some negative effects from alcohol use.
Okay.
And so what it tells me is that it could be from that injury that you had said, either yourself or someone else back in college.
Yeah.
And
or I guess those few occasions when I've had like more than 5. That's like New Year's or like birthday party or something like that, and that's okay. That's probably too much, I guess.
So I'm just gonna sort of do follow-up and just explore that a little bit more. But before we do that, I'm just going to go in and jump into our next screener for depression.
For
Is that
depression.
okay?
Yeah, sure.
All right.
Let's do it.